Around 5,000 years ago, ancient Egyptian physicians were packing open wounds with honey, with no understanding of bacteria, infection, or antibiotics. They just knew, from watching it happen over and over, that it worked. What's genuinely remarkable is that hospitals today, using sterile, medical-grade honey, are doing essentially the same thing, backed now by real biochemistry instead of pure observation. The earliest known reference to honey in wound care comes from ancient Egypt, somewhere between 2600 and 2200 BCE, and archaeological evidence shows honey being used directly on wounds as early as 3000 BC, with traces even found preserved in Egyptian tombs. This wasn't a one-culture phenomenon either. Written records and archaeological findings show the ancient Greeks and Romans independently using honey on wounds as well, meaning multiple ancient civilizations arrived at the same treatment, apparently through simple, repeated trial and observation. For thousands of years, this practice continued largely unchanged, right up until the 1940s, when antibiotics were discovered and rapidly became the dominant treatment for infection. Honey, understandably, fell out of favor almost overnight. Why bother with a sticky natural substance when you had a lab-synthesized drug that killed bacteria directly and reliably? Here's the twist nobody saw coming. Decades later, antibiotic-resistant bacteria began emerging as a serious global health problem, strains of infection that no longer responded to the drugs that were supposed to reliably kill them. And in that specific gap, honey made a genuine clinical comeback, this time studied rigorously in labs rather than passed down through folk tradition. So what's actually happening chemically? Honey is hygroscopic, meaning it naturally draws moisture out of its surroundings due to its extremely high sugar content. That dehydrating effect alone creates an environment bacteria simply can't thrive in, since most bacterial growth depends on available moisture. But that's just the baseline mechanism. Research has gone much further, particularly with manuka honey, produced in New Zealand from the nectar of the Leptospermum scoparium shrub. Manuka honey contains a specific compound called methylglyoxal, present at concentrations up to 100 times higher than in ordinary honey, which acts as an additional, direct antibacterial agent on top of the sugar-based dehydration effect. Lab studies have shown manuka honey specifically inhibits Pseudomonas aeruginosa, MRSA, methicillin-resistant staph infections that are notoriously difficult to treat, and even vancomycin-resistant Enterococcus, another serious antibiotic-resistant strain. This research has led directly to something called medical-grade honey, which is meaningfully different from the honey sitting in your kitchen cabinet. It's produced, sterilized, and standardized specifically for clinical use in treating wounds and burns, and it's increasingly being positioned as a real tool in the broader fight against antimicrobial resistance, precisely because bacteria have a much harder time developing resistance to honey's multiple simultaneous mechanisms compared to a single mechanism antibiotic drug. So here's the honest, remarkable through line. Ancient Egyptian physicians had no concept of bacteria, no microscopes, no understanding of methylglyoxal or hygroscopic pressure. They had thousands of years of careful, repeated observation about what actually helped a wound heal, passed down across multiple independent civilizations. Modern medicine didn't invent this treatment. It rediscovered it, explained precisely why it worked at a molecular level, and brought it back into hospitals at exactly the moment our newest tools, antibiotics, started running into their own limitations. Sometimes the oldest remedy in the room turns out to be exactly what a hospital needs today.